Hi, I'm Dr. Hugh McPherson, and I'm a spine surgeon at Peak Orthopedics and Spine. Well, when we look at spine injuries, we often think of spinal cord injury. That's obviously a very acute injury, and particularly in sports and contact sports such as football, you have to be very aware of the possibility. Those injuries are much more serious, have to be immobilized quickly and sent to an appropriate facility for evaluation. Fortunately, in sports-related injuries, most of them are muscle and tendon and ligament. They're soft tissue injuries that are short-lived and can be resolved with rest, activity modification, and appropriate retraining and strengthening of muscles. The other conditions that we've talked about, including scoliosis and spondylolisthesis, don't necessarily have to limit an athlete's return to sports, but do have some specific concerns to be evaluated so that the athlete can be educated about their risks. In children, we tend to be less likely to operate on them due to the recurrence rate. And so most of the injuries we see tend to be managed non-operatively. Well, I think the key to remember whenever you suspect that an athlete has a spine injury, particularly in the setting of a contact sport where there's been trauma, is that this injury is very different from how you might treat a knee injury or an obvious fracture. Sometimes the thought is to get someone up and try and walk it off, and the spine is very sensitive to any instability or trauma. And so the key to any suspected spine injury is that that athlete is really done for the day. Immobilize the patient, don't try and get them up or moving, and you want to have appropriate help to facilitate that. It's not something that a layperson can do. It requires some specialized training to immobilize the spine and transport people. And I think that until they've been evaluated in a hospital, you really can't let them get up and move around and return to that sport.